Dak Prescott is expected to miss several weeks to undergo hand surgery to repair fractures sustained on these throws. Welcome back, everybody. I'm Dr. Brian Sutterer, and if you're new here and enjoy learning about sports injuries, the mechanisms, and the underlying anatomy, then be sure to subscribe to this channel to stay up to date with my future videos. There were really two throws where Dak could have injured this thumb. The first of them here, he comes through with this follow through, makes contact with Shaq Barrett, and as Barrett is coming through, basically contacts Dak's thumb. Now, we can't see exactly if Dak's thumb was forced into what we call hyperabduction, with it coming sort of backwards, or hyperextension, which would be more likely to injure the ligaments, or if it was just what we would describe as axial load or compression, meaning a force kind of directly going into and kind of jamming the thumb. The next throw, then, we could see the same sort of thing. Dak releases the ball. You can see a little bit where that thumb is, and then Barrett's hand just makes contact again with Dak's thumb, likely, I suspect, leading to more component of axial compression because of what we found out was the actual injury with a fracture, as opposed to suspicion for a ligament injury. When I first saw the play, my concern was for a ligament injury, specifically the UCL, a little ligament that sits on the inside of the thumb, and can often be injured when this happens with quarterbacks. When they throw a pass, make contact with a helmet or make contact with another player, and their thumb gets bent awkwardly backwards. That can injure this little ligament shown here in green, the UCL that sits on the inside of that thumb joint. But Dak said after the game that this was more of a true clean fracture. He thought initially he had jammed his thumb, but this was just a clean break, and they've already got surgery scheduled. We'll review the anatomy and what this fracture might look like next, but first I want to give a quick shout out to the sponsor of this video. This video is sponsored by a longtime supporter of this channel and a product that I love using, Element. Element is an electrolyte drink mix that features all the electrolytes your body needs without any of the added junk that it doesn't. Simply put, our bodies rely on electrolytes for proper function, and when these levels become altered, we can suffer from side effects like fatigue, muscle cramps, and headaches. One of the most common ways athletes can lose these electrolytes is through sweating, and Element is my go-to for after those long, hard workouts to help replenish those electrolytes. Each Element packet features 1,000 milligrams of sodium, 200 milligrams of potassium, and 60 milligrams of magnesium. But my favorite part is what it doesn't have. There's no sugar or added artificial junk ingredients. Right now, Element is offering my viewers a special deal. If you head to drinklmnt.com/BrianMD, you're gonna get a free sample pack with 8 individual packets with any purchase. My personal favorite is raspberry, but this way you can try all the flavors for yourself or just share some with a friend. So once again, head to drinklmnt.com/BrianMD to get a free sample pack with any Element purchase. Thank you again to Element for sponsoring today's video, and let's get back to our learning. Let's walk through the anatomy of our hand and specifically the thumb. So when we're talking about the different bones of the hand, we have our metacarpals. They're the bones that sort of sit through the palm. And the first metacarpal, or what we might refer to as the thumb metacarpal, is right here. And I suspect that's probably the bone that's involved, just based on the way that everybody described this and sort of the common mechanism. My suspicion is that it involves this first, or the thumb metacarpal. We could also see on the sideline where they were basically palpating or pushing on his thumb. And it looks like they're pushing more down at the base of the thumb as opposed to the UCL ligament area, which would be higher up here. The other way we can read between the lines here is, of course, at the stadium, they're not going to have an MRI scanner to look at the ligament. They're just going to have the x-rays. And while you can certainly see an avulsion fracture if the ligament is torn and pull a piece of the bone off with it, you might pick that up, but it's certainly going to be much easier to see just a clean, simple break of a bone like that metacarpal, again, making just a metacarpal fracture more likely. Learning point here about metacarpal-based fractures with the thumb. There are 2 named fractures that we'll talk about. The first is called a Bennett fracture, and a Bennett fracture is one that involves the joint, meaning it's intra-articular, but it's just one clean break. The second type is a Rolando fracture, and that's more complex. It's a comminuted fracture, meaning it's multiple pieces that involve the joint as well. Both of these types of fractures in a high-level athlete that it's their throwing hand are going to require surgery. And even fractures just around the thumb often require surgery more than the rest of the hand because there's just more forces pulling on those 2 ends of the bone. The goal of fracture treatment is to get the 2 ends of the fracture back together. But you have all these distracting forces of ligaments, muscles, tendons, etc., pulling on those 2 ends of the bones. And the more forces you have, the harder it's going to be to get those 2 ends to stay in place with just a cast. A return to play timeline after surgery is probably more accurate to be around like 6 weeks with a fracture like this, but potentially 4, just somewhere in that 4 to 6 week range, depending on if things go as expected. The big key though here to pay attention to is sometimes we discover other injuries when we do more evaluation. So it's possible that he has multiple things. He could have a fracture through the bone, but also have a ligament injury that they just don't appreciate right away. Because of all the trauma to the hand, you can have things torn in multiple places. And so ultimately, something like a torn ligament might further dictate recovery if that's discovered on the subsequent evaluation, which we certainly have to prepare for. Correlating the anatomy to the mechanism here, these thumb-based fractures typically occur when there's some axial load to the joint. So basically a force coming in directly this way that jams the joint and compresses that bone. When it gets jammed, those two ends are going to shear past one another and cause more of that oblique fracture pattern, something like that Bennett fracture. So if we go back to the play where this occurred, again, as Barrett's coming through making contact with Dak, his hand pushes into his thumb, some axial compression likely on that thumb, that first metacarpal, likely leading to what I suspect would be something like a Bennett fracture. And that's it for the video. I hope this was educational to look at some of the anatomy of the hand, talk about these different fracture patterns and other injuries that we might have to look for. Again, keep that part in mind. Whenever we do an MRI scan, we'll sometimes see other injuries that might have been distracted from because of the initial pain for the fracture. And those other injuries might have a bigger influence on the recovery time. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.